Good day, ladies and gentlemen of the board. Today we are reviewing our understanding of moral and ethical healthcare. Our beginning for our reacquaintance with our topic started years ago with our mission statement, vision statement, value statement, and our diversity statement. You, our board, on the first meeting, not unlike today's meeting, came together from different medical specialties, cultures, and under one religion, determined to put into writing a declaration of the ethical and moral practice for a base to this establishment. These statements have guided organizations, the HCA core measures. Our organization values the high standards manifested by these core measures in the HCA rules and regulations. With all these cases presented to this hospital, our healthcare teams continue with the integrity of our core ethics, core measures, and our basic Hippocratic oath. The dilemma of our healthcare workers has this very basic statement tested with every patient. Prior to these patients, assessment for our hospital provides informed consent forms with a full listing of the policies and procedures of our organization and of our staff. ASA makes sure each person's healthcare services remained within the patient's EHR document with a detailed planning of their care has coverage of the informed consent form. The recognition of this one basic point carries the do not harm now encased in the policies and procedures of our ethical mission statement. Bridging the gap from first presentation into the facility with our informed consent forms to the eventual care of the patient allows this organization to audit the cases presented to this hospital via our fairly new electronic healthcare records, or EHRs. This is guarded by our HIPAA law, which established the guidelines for EHR. Our mission statement to our value statement carries out the spirit of the privacy and safety regulations of the HIPAA rulings. This responsibility of our organization is solidly based within our moral and our ethical approach to basic patient rights that govern these EHRs. Proposed continual education for our staff helps to safeguard our accreditation for our facility. Maintaining the privacy and safety of our patients with the ethical use of EHR, this meeting today has come full circle. This trip down memory lane has established a sense of development that leads us to the current issues at hand, the yearly allocations of our organizational resources. If you will review the information that is now showing on the slide, we can begin this discussion with the reasonable resolution to our deficit of $200 million. Each facility department has inventoried their units and placed a request for the next fiscal year. Our government body will review the information collected. Once this is completed, a free outsider consultant can offer new perspective on where the best use of our allocation resources are to be utilized. Working today with the budget in hand, I feel that we need to assemble an ethics panel to review all cases presented in this facility. By doing so, this hospital can decrease the frivolous lawsuits lodged against it over the last year. The education webinars will be shown for each shift and be a part of their ability to remain as an employee. Other compliance issues will be addressed during the next fiscal year. Ongoing review of the physician's cases for possible litigation will be directed to our lawyers. Many of these suits are false accusations. However, the review may indicate where trouble areas reside. Everything done as a service to the unknown masses is subject to the quality of that service. If we do not live by our mission statements based on our ethics, then we have already lost our ability to perform medicine practices. Do no harm then has no meaning, therefore we are not fit to serve the public's ills.